Welcome to Talking HealthTech, everybody. Today, we're diving into the world of digital health research with three brilliant minds from the Australian Centre for Health Services Innovation. We've got Professor Steven McPhail, Dr. Sundresan Naicker, and Associate Professor Amina Tariq joining us. All three are doing some incredible work in making healthcare smarter and more efficient. Can we start off by introducing yourself and what you do at AusHSI? Steve, let's start with you.
Hi, I'm Steve. I'm the Centre Director at AusHSI, and I have many sort of jobs, I feel, but my background is in health economics, and I also do some digital health implementation work, and was formerly a clinician as well. So those things keep me busy trying to pull that together while we do health services research.
Hi, I'm Amina, part of the AusHSI team here, working on different projects looking at digital health. Come from a software engineering background, just liked health a little bit more, so biased towards it. And also lead the education programs here at QUT, mainly around digital health.
Thanks. Hi, I'm Sunny. Sunny for short, actually. I'm a research fellow also at AusHSI, and I really focus on the translational elements of digital health and related sort of interventions. And we call that the discipline of implementation science.
Awesome. Well, why don't we start off the conversation with maybe a basic question, but one that kind of tends to garner different answers, especially depending on who you talk to, and certainly between researchers and maybe other players in the health field. Steve, what exactly are we talking about when we talk about digital health from your perspective? And how would you kind of define it for the general public?
That's an interesting question. We used to start off calling things e-health. We had mHealth for a while, telehealth or telemedicine, and then that came lots of variants with telerehabilitation and so forth. But really, digital health is, we've got to a point where we have digital technologies in a lot of healthcare delivery aspects and healthcare organisation aspects. And so digital health is probably the umbrella term that captures all of the ways that we use digital technologies in the delivery of healthcare. We're probably getting to the point where at some stage we're probably going to get past using even the term digital health, because it'll just be health, and that everything we do has a digital aspect to it these days, and it'll be the same in healthcare. So digital health is really an umbrella term that captures a lot of the technology aspects of what we do in the delivery of healthcare.
And I think just to even segue from what Steve is saying, I think oftentimes when people think digital, they're often focused on maybe some researchers in the basement doing code, and that's far from what we do actually. A lot of it is about the social system. It's about people and things and how that comes together to improve outcomes for everybody.
Yeah, completely agree. I think that's the most important part. When I talk about it in front of my students, it's very interesting, the examples that you come up with, like biometric monitoring, RFID, and then suddenly we talk about, what about you booking an appointment using a website or using a mobile phone application, and that it may really become realistic for them, then they can relate better. So I think it's very interesting, the broad umbrella of digital that we capture when we are working in health. So it can be anything that actually you do in your phone, almost relevant to what you do in healthcare. So I think it's a very interesting times, because everything we do in health actually has somewhere a digital aspect. And it's going to be even bigger now with AI and everything coming together.
Still occasionally done in basements, but
occasionally still
probably less frequently now. Yeah.
I guess I want to move the conversation now onto a little bit more about AusHSI, and I want to hear more about each of you and your particular research in digital health. So Steve, I heard you're doing some work around patient attendance. Can you share with the listeners how digital solutions are making a real difference there?
Sure. Yeah. So non-attendance at appointments, or even non-attendance at scheduled surgeries, is a real issue, which sounds surprising, even in public healthcare settings where there's essentially the service is free to access. The coordination of having people turn up for their appointments on time and at the right time and on the right day is surprisingly challenging at times. And there's many reasons for that, as people have the complexities of everyday life, and there's often good reasons why people can't make appointments. However, when we've got some limited resources in health to deliver a clinic or to book out an operating room, we need to make sure they're being used well. And there's a lot of ways in which we can use digital technologies to help that happen. And that could be as simple as reminder systems are often very common way that we implement strategies to help people remember where their appointment is and how to get there, and make sure they're well prepared when they get there. But even that, just that one example of a reminder that we might have all had on our phone at some point. Well, what should actually go into that reminder is a good question. Is what's going to be effective? What's going to be helpful for consumers? But then maybe we want to move beyond that towards being able to also have interaction. Maybe they need to reschedule the appointment. Maybe they need to understand where they need to go or how to get there. And this is getting in a bit more complexity, but we may even get further beyond that, where we're looking at using artificial intelligence, for example, to determine which strategies might be most effective for which consumers to help them to get the information they need. And similarly, when we're scheduling appointments, how we do the scheduling in a way that makes the best use of the resources to allow for the fact that patients don't always turn up, despite everyone's best efforts, including the best efforts of consumers to try and get to their appointments.
Wow, really important stuff. I like what you said. It's kind of one of those most basic things about healthcare, and you wouldn't think that people would not turn up for their appointment on the day. And yet I see it a lot in my work as well. It's really cool. Sunny, I've heard doing a lot of work in AI in radiology. It's something that's getting a lot of buzz because it's such an impactful kind of application of AI. Can you talk us a little bit more about what's happening in that space from your perspective?
Yeah, sure. And just to add, in fact, this is work we're all doing. We're also all collaborators on this piece of work. And so what we're actually looking at is testing an artificial intelligence program, a piece of software, in an actual real-life hospital radiology department. Now, this software in a lab setting performs really well. It's got what we call really good or excellent sensitivity. It's detecting what it's supposed to detect, and relatively good specificity. So it's detecting the right thing in the right place most of the time. But we find often in digital health, as I just alluded, it's more about more than just how well the technology performs out of context. It's really important about how it might perform once it's actually adopted by practitioners and used to improve patient outcomes. So in this case, I think we trialed what might be an Australian first, and where we actually looked at an artificial intelligence technology that's being adopted in practice, and we evaluated how well that's actually working in practice. How is it changing, for example, clinician workflows? Is it being understood? Is the knowledge generated by the software actually understood by clinicians? Is it really improving their reporting time and the accuracy of what it is they're doing? And we found that while there was certainly people were very keen and very interested and very positive about this technology and AI and radiology in general, it's not without challenges when you actually adopt it into a very busy public hospital system. And a lot of those challenges stemmed from, I think, a lack of coordinated communication. It's really hard to get a group of clinical champions worrying about how well this is being adopted and also doing all of the other things they needed to do. And I think this sort of was a bit of a setback in terms of, ensuring that the technology was working as intended. And I think, a lot of fine-tuning and working with the technology developers to ensure that the parameters were actually set in a way that was effective for a changing system that was quite fast-paced. So this is a clear example of where even when you have really great technology, there are many challenges in actually getting it to work in the real world.
Is that something you've seen kind of consistently throughout your research in digital health, that you can have this great idea for tech, but actually getting it into the hospital, getting people using it, something happens there? Is that something you've kind of seen across more than one of your projects, your research projects?
This is something I think we all see in all of our projects all of the time. In fact, two of the biggest challenges in our work is what we call inappropriate use of a technology and abandonment of a technology over time because of these challenges, because perhaps the adoption isn't planned, it's not sustained over a period of time, maybe because of inappropriate resourcing or a lack of adequate training, or the unintended consequences. So remember, in a system like healthcare, when you make one change, you might also change some other things down the line. And so you need to kind of have an awareness of what that might look like or how to observe and measure that. And also how to respond to that as well.
Yeah, of course. Amina, tell us a little bit about your research work. I heard you're working on some research in demand management. How are kind of systems helping hospitals handle patient flow a little bit better?
Thanks, Regina. That's something that really relates to the conversation we just had, that, healthcare organizations are really not technology organizations, right? They're not, their main core business is not IT. It's providing healthcare. But I think digital has really challenged them in a way to think about how to grow their digital capacity. Digital systems are more and more part of their daily, service delivery. So again, it has really challenged them to develop informatics capabilities in-house. Despite being a lot of systems, third-party apps or devices or systems, especially the electronic health systems, actually are mainly third-party. But I think what we are trying to do is work with health services to develop mechanisms by which they achieve digital maturity within organizations by making informed and evidence-based decisions. And while it may sound simple, imagine the influx of thousands of requests coming on a regular basis to them. I need an app for this. Maybe we can have a dashboard for this. And like you said, ideas always sound exciting. What can health services really do to develop that digital portfolio in an evidence-based way so that the money they're investing is really in where they can get the maximum benefit, both for patients and themselves as health services? And not to our surprise, especially because, digital maturity is still in early days for healthcare services, we realize that while we as researchers may think that processes are out there and they can easily grab and make very informed decisions, the complexity of health service operations really need to be considered when we are developing these solutions, like how can they prioritize making digital health solutions. So it was interesting activity. All of us actually went with the biggest health services here in Queensland and sat down with their clinical informatics team to look at the complexity of requests they deal with. And I don't want to take the full podcast away in dealing with the complexity, but healthcare is complex. Somebody may want a simple app that may be confined to a department, but somebody may need a statewide solution or something that's actually changing national health system. So we developed this evidence-based framework with them to make them understand if they have so many requests for digital systems coming, how can they screen them better? And actually that creates a lot of transparency, honesty, and you really need to build that trust, which is crucial for technology as well. And that's where a lot of abandonment and other conversations are also stemming, that we need to build clinicians' trust in the technology they use. So I think the work that we have done in developing that solution, it's still very early days. It's actually one of a kind, to be honest. We are really hoping it starts that conversation across different health services with different digital maturity and capacity. How can they make evidence-based decision to manage this increasing demand, which is always going to go up? Everybody is now thinking AI is the sort of go-to thing for everything. So requests are not coming down. So I think the work that we have done in its space is very noble in the way we have actually sat down and co-designed our solution with the health services. So it's not only researchers opening books and finding a solution. It's actually a tool that we developed in consultation with the largest health service here in Queensland. So I think that's very important and crucial piece of work, that while we develop all these technologies that may be providing some sort of benefits to the patients, we also look at how health services themselves manage that capacity and digital maturity, which is instrumental to any digital success.
Yeah, wow. So it's essentially kind of handing a health service a framework or a checklist to go, we've got all these requests coming in, how do we evaluate the effectiveness and all?
Absolutely.
Where do we put our digital health budget this year? We can't take it all. How do we do this well? It's an incredible area of research to be looking into, and one that I can see has so much applicability across the health system.
Probably one thing just to touch on there is that it's not so much providing a framework for people, for organisations we haven't engaged with, but rather it's co-designed with and in the context of. So it's not as though we have the solution that we are trying to give to anyone. It's that we listen to what the issues are and help them to find solutions. Now, yes, in the case of demand management strategies, which actually lead into the broad issue of portfolio management more broadly. So not just the new demand coming in for new technologies or new ideas, but how we actually need to stop doing some things. We need to stop using some technologies. Some things come to the end of their life cycle, and we need to move on from that and to do something else. And the way we go about our activity is not to tell people what to do, but rather to listen and understand and help people find solutions through co-design strategies, as Amina sort of described.
And I think a good segue and maybe a reminder as well for people out there, I'm sure they already understand that intuitively, is the provision of healthcare and clinical practice is fuzzy. It's not always a binary problem. It's not always a black and white issue. It's nuanced, and really technology is meant to support that human decision-making, that differential diagnostic process, not replace it.
No, it's an important balance to strike. You've all got kind of slightly different research leanings, and I know you're all collaborating together on lots of projects, but I'd like to hear from each of you kind of your perspectives on the common misconceptions maybe around digital health research in each of your areas of expertise. Steve, do you want to start us off?
I could probably make a long list. If I had to pick one of the issues that's probably top of the list for misconceptions, it's that we need another predictive model to predict some sort of risk or to advise a clinician on what they should do. More predictive models that produce interruptive alerts, that's probably not the thing that you need. You might think that's what you need, and I think actually what we know or what we've learned is that when people have access to data, they think that's what I can do, so they try and do it. But when you really get on the ground and understand how systems are implemented and what things are going to really improve practice, and I think there's enough evidence coming out now that's showing a lot of time and effort has gone into developing predictive models, whether it's conventional statistical analysis that develops it, whether it's machine learning and AI. A lot of the great performance in a lab doesn't translate to actual benefits for patients, and clinicians already have a lot of interruptive alerts. That's probably not, in most cases, the solution. Now, I know that there's a lot of people who've made a career out of tweaking a predictive model to get an extra fraction on their C statistic, but I can tell you that on the ground, that's maybe not going to be as helpful as some other solutions. So if I had to pick one thing to sort of explain was a misconception, it would be that another predictive alert based on another interruptive alert based on a predictive model is probably not the thing that you need.
Yeah, I couldn't agree more, Steve. Something that, flows from what Steve said. I always think like technology is like one slice of the pizza that you're trying to slice in digital health. The biggest misconception I see is that conversations start with the technology, even when you're developing an idea. Look, maybe we can get an app, but who will use it? Are people using the similar things? So many social leadership adoption ideas that need to be explored before even looking at what tech we really need for it. One of the examples that we did some work here at QUT was like looking at, giving people a guide on how to manage a child that has burned. And they developed an app, didn't work. They realized actually promoting videos on Facebook was a much better solution. But that was much after investment had been made in developing apps and solutions. So we realized that all the time as, software engineers as well, that, whatever ambitious idea we have in technology may not work. So technology is just very, part of the puzzle. We need to solve the bigger puzzle first to actually see what part of the tech would really work. For example, predictive models that Steve just highlighted, that before jumping in, let's see what's the real need, where it is used, and how clinicians actually daily work. And I think a lot of work in tech development is done as work as imagined. And we are very much at AusHSI champions of work as it real happens. So I think that's the idea that sometimes when we work with health services, they're surprised to see, because the biggest myth is you start conversation with technology or you're the technology expert. Probably not. That's not how we start conversation. It's more about what's your process, what's the gap, what are we trying to look at here, and then technology may or may not come as part of the puzzle. So I think while digital has taken the first word in health should come first.
And I think just to really add to what both Steve and Amina are saying, really, this might not be a new thing, is just I think maybe people might be surprised to realize how behavioral and how much the work we do is about, like I said, people and systems. Why do you want a predictive model in the first place? What is it that you want to change? What kind of new information do you want to communicate to someone? How do you want to communicate that? What for, So it's as much about sort of replacing old behaviors perhaps with new ones, or new information with new ways of thinking, as it is about maybe changing actions and behaves in the system that actually might not contribute to better outcomes. So it's really about better value care in all instances, whether that's less of something or more of something. It's really about appropriate care that's valuable for the system. So it's very behavioral. It's very person-centered stuff, and I think maybe that's not probably always understood.
Yeah, so it's really co-designing for a healthcare system that works better than it currently does right now. I often think sometimes we just design systems for the healthcare system we have right now, and it just replaces bad processes with bad technology sometimes, unfortunately. So it's good to hear that you spend that time really working with clinicians on the ground to see what they're doing right, what they're doing wrong, and kind of working with them there.
Yeah, I think it's probably worth also thinking through that there's a applied clinical setting where we explore work as it's done and human factor elements, implementation science. But then there's also a few steps back or around where actually how are we going to govern this? If we're bringing in a new solution, what's the clinical leadership that's required? How does that affect the liability for different parts of the organisation? And often there's actually, we know how to do this in healthcare. We know how to bring in new innovations. We've been doing it since healthcare began. The difference though now is because it's technology, we sometimes get confused and think, well, it doesn't need to be tested in the same way to ensure that it's safe and effective. Or we don't need to think about cost effectiveness in the same way as we might for anything else because it's digital. Well, no, that's actually not true. We actually have systems and processes to help figure out if things are cost effective, if they're safe and effective, and most important is probably safe to start with. To deal with privacy of information, we've been doing that for a long time. And so I think this is a domain where as we're bringing the technology aspect into a model of care change, and there's a clinical side, there's also the organisational side that's an important consideration.
And we have to look at it all, right? We can't ignore either side, otherwise it doesn't work. Yeah.
That's right. Absolutely.
It really is a systems approach.
Systems approach is a good summary, yeah.
Yeah, really important stuff. I guess I want to ask now, Sunny, looking at the next few years, what do you think we should be paying attention to in terms of regulations and guidelines? I guess AI is a big one, but even more broadly in healthcare and digital health. What do we need to be looking at in the next few years?
Man, it's exactly what you just alluded to. It's really, I think, like most things, but particularly technology and in the space that we're in right now with that exponential movement with machine learning and AI, the innovation's probably happening at a more rapid pace than the system can keep up with. And so consequently, that creates a couple of challenges, particularly around, how can clinicians and how can healthcare providers and decision makers make the best decisions for their patients and for their communities when they're kind of overwhelmed with all of this information. And, what's a good way for them to quickly and rapidly understand the evidence base? And how can they get guidance from that? And so some of that is a little bit around governance, around legislation and what Parliament can do in terms of, how we regulate the system. And some of that is also around, what are the minimum standards that vendors need to meet to establish and ensure that the people that they're actually procuring to understand what it is their system's doing completely. So I think that's really a key gap we really need to think about and do better in. It's changing, but I think there's probably a lot more work to be done in that space, as I think Steve and Amina can allude to. That's just the tip of the iceberg, but maybe I'll leave it there and let
Yeah, completely agree. I think the challenge we have seen globally with tech is that it outpaces everybody's imagination and development, and regulation is just in the sort of chasing things up. How should we do this? By the time they have trained on millions of people's of data, we are still thinking about should we do it or not. But I think it's important to think about, especially knowing that more and more data in healthcare is becoming digital, and it's not only about data governance. In my opinion, it's about process governance and how you actually look after the entire process in which things happen. And data is pretty much collected at the every every instance of the process that happens. That it's really challenging in AI because a lot of things are happening inside the technology, and unfortunately the models that we are using are still pretty much black box for the health services. And we look at the output, but we have to sort of unpack that a little bit more in layman terms about for our consumers and for our clinicians about what that model really represents. And that's still very challenging to do. And that's where, again, the conversation about really, do we need a predictive model for that, or should we sort of think about, is there a more ethical or a more, simpler way to do things? So again, it can actually be taking a strong tech element out of the process when you think about governance and ethics and equity. And I think health, like other health services, is pretty much part of the sort of, most high risk domain as well. So when we look at health, the risks of information, for example, being mismanaged, or cyber wars, are very, misuse is so common. So I think that's something that really needs to be tackled well. While there is a lot of road mapping happening and we are hearing a lot of guidelines, I think at AusHSI, for example, we are working more at looking at, okay, there's a guideline, how do we implement it? How do we make it realistic for healthcare organizations to really implement? And I think it's very interesting to see that how much that can be challenging when you already have, certain guidelines and certain processes set, and tech sometimes challenges to shake the pace in which things happen. And that's something that's very common when it comes to technology.
Yeah, I think, I reckon it's been interesting lately, maybe the last, 2 years, year and a half. We see this abandonment of common sense towards the adoption of a belief in, magic with AI. I think as we've had these, the general, So we've got large language models that people don't necessarily understand, but it solves their problem for whatever question they're asked, whether it's trying to generate a story for a 5-year-old or trying to work up a draft of a document that could be formal. And so when we get the point of coming into healthcare, I think there's like this feeling, let's just get AI to solve it. And there's this abandonment of all the logic that we probably would normally have around the need to actually evaluate that and develop it properly and ensure it's not a black box, and then really stretch into those important areas around, are there any groups of people who are going to be disadvantaged by this? Is it going to work just on particular subsets of the population to the disadvantage of others? We talk about it in rhetorical sort of terms, but then when the rubber hits the road on the ground, that maybe this stuff hasn't been dealt with sometimes, and that's a bit frustrating, I reckon.
Bias is an ongoing concern, right?
Absolutely.
It's something we struggle with.
And, absolutely.
Is the right population sample for the right context? Who are we leaving out? Who's not represented? Will this look different in a different population? Sometimes we don't always know those answers.
Yeah, and I think the challenging thing that can occur, of course, is that when we have a system where vendors have a certain objective to sell a product, and then we have health officials who are, wholeheartedly pursuing good healthcare for their constituents, whoever that may be, there's a tension here between the informational imbalance that can occur. So I think that's a real challenge for the future in terms of overcoming that informational imbalance and calling out some of the things that can sneak in the middle of a frenzy of activity around a new technology that is maybe best kept out. So that's something to think about. That's not to say, though, that there's not a lot of excitement, right? I am very bullish on much of the advancements that we're seeing, but it's got to be, we've got to be mindful of these threats as well that can creep in. And to that end, actually, the other thing that I think sometimes we underestimate is risks around cybersecurity. And so I know we've all talked about this before, but the real concern of bad actors actually intentionally trying to do things to disrupt healthcare services. We've seen it in many countries around the world. We've seen some examples in Australia, and this is a threat that's probably not going to go away. And in fact, the trend would indicate the opposite. This is an important consideration as we're working in the digital health space. Don't want people to be paranoid about it, but certainly need to be mindful of it and thinking about how we're helping to make sure our organisations are resilient.
And I also think, very much like the kind of early stages of the desktop computers being introduced, right? And everyone needed a little bit of computer literacy to go and do the things they need to do, and now a lot of it, right, to do our jobs. I suspect that potentially for machine learning and artificial intelligence, we might need some basic literacy around that too, particularly if we're involved in using those technologies in high-risk situations and improving patient care, for example. I think that we might see a change in that expectation.
Yeah, they're good points. I guess before we wrap up on our conversation today, I'd love to hear a little bit from each of you about what excites you the most about AusHSI's approach to digital health innovation and what's keeping you in digital health research.
Really, for me, I think what we do it at such a human level. It's really a combination of the best of the scientific method with humanist principles. And what I really mean by that is actually lots of different types of people and expertise coming together, working with the system as a collaborator, not as an outside researcher, to try and really, I think, transparently improve outcomes. So the types of research that we do is very translational. It's the kind of thing where you can see that improvement in 12 months, sometimes 6, right? Sometimes 18. And that's really rewarding. You know, you get to make that kind of meaningful, sometimes very visible impact. And that just keeps you going, because I think we're all there to kind of improve systems. It's all about, can we make this better for everybody, in the best possible way? And that's an ongoing question that's always changing. And that's really what I'm passionate about. Equitable healthcare for everybody. Good quality healthcare, I should add as well.
Yeah, couldn't agree more, Sunny. I think we are all on it to improve things. I think the thing that really inspires me with the work that we do here at AusHSI is being very real about it. While all of us, I think, are very sort of, well-read researchers, read frameworks, read exciting things, I think nothing excites us more than being in a chat room with health services and listening to the problems, and really sometimes actually getting a kick out of thinking, oh, we knew it, thank God, whatever we were thinking in our room is really applied to and is helping them. So I think that's something that really inspires me. And for me, I think, as a person that started technology training really back in early 2000s, and now looking at technology the way it has evolved, I think finally is the time that we will see digital really helping health. While we have done, all the layground basic work and battles of getting those electronic health records. So I'm really excited that we are part of digital health now, when we are actually looking at the big pictures, really looking at reaping that person-centered care using technology finally being achievable, because you need all those baselines set up, which no matter how painful they are important and crucial. So I think we have done the baseline work. So I'm really excited, because I think it's going to be fabulous being a researcher in this space, because there is so much opportunity and so much to contribute to the improvement of health services.
Yeah, I agree. And I think sometimes it doesn't feel like work when you're doing things that you would like to do anyway. And so I think reflect back, working clinically, which is really rewarding, and helping one patient at a time is really rewarding. But the sort of work we do is exciting because there's sort of scales that a lot, where we're able to help work with really clever people, experienced clinicians, experienced health service managers and executives, as they're looking at solving their problems. And their problems actually mean problems for real people who require healthcare or accessing services for one reason or another. And being able to help them bring innovation to life in their own real-world environments in ways that impact people's lives for the better, that's really rewarding. And that can happen in lots of ways. And we bring in different aspects, whether that be the implementation of science, human factors, the health economics, whether we're looking at statistics and data. There's a lot of elements that need to come together to make a change in digital health. And when we're working with partners who bring the suite of clinical expertise that really is required for the healthcare system to be improved, I think together that makes it for exciting work. So that I really enjoy to be part of that.
Steve, I'd love you to think back a few years. What do you wish you knew before you came into digital health that you know now?
Ooh, that's a great question. I might actually defer to Amina here, who's come from a computer science background originally before moving into health. So, what do you think, Amina?
Oh, I think as a computer scientist, health does come as a bit of shock to your system. But one thing that I've learned in last 15 years is change and complexity is the constant. So don't be scared. Digital does bring a lot of change, but healthcare is always changing anyways. So we shouldn't be scared of the complexity and the change that happens. And adaptation is actually one of the qualities that healthcare has more than tech. So as technicians or as software engineers, we do freak out if a platform changes. I think our clinicians, our health professionals are way more adaptive than what we believe they are. So because they adapt, they deal with high-risk situations, so they are much more calmer. So I think that's something that I learned a lot as somebody who has worked in early days in aged care settings and in primary care, the situations and the complexity and change they go through on a constant basis. Hats off to the health services for managing that well. But I think something that I've learned that, it's just a factor that in any research that I do, I now take it as a default, that it is there. Let's work with it.
Yeah, I think it's also maybe being less intimidated by the system. I think when you first start as a junior researcher, this can happen. But the thing about our systems and the work we do is that people are so transparent and so sort of hungry for improvement that it's really about those relationships, that trust and transparency and being present. In fact, working with people at that level, it's been a privilege and far easier than I anticipated.
Yeah, that's probably similar for me because when you move into a different space or you're engaging with people in a different way, that commonality of vision, that shared vision, even while things might be different with the technology, we're in a new place or a new model of care that's supported by technology. One thing that's always a constant is that we're actually all there to try and improve someone else's life. And that could be most often it's improving consumers' lives through better healthcare, but actually sometimes it's about improving the clinicians' lives. And I think that when we have a shared vision for that, it makes the job easier, and actually it brings us together from different perspectives, but to really want to work collaboratively in a constructive way. And that actually extends all the way up to managers, over to people who are just working in the IT. They want the systems to work, and they're in the healthcare space because they believe that's important. And so I think that shared vision is powerful, and it actually helps smooth over a lot of rough edges. When there is complexity, when there is a challenge related to different microsystems within a larger healthcare context, where the benefits are not always the same for every party, and it may actually cost someone a little more over here to get the benefit over there. That shared vision of why we're in this and why we're in this together, I think is really powerful, and I wish I'd realised that at the start.
This might sound glib, but the value of having a coffee.
Yeah, right.
Going with someone for a coffee and having a chat about what's going on, and those are the kinds of things that shared human experience, as corny as it sounds, actually I think makes for a better environment and kind of better outcomes as well.
Love it. Well, guys, that wraps up our deep dive into digital health with our experts from AusHSI. I guess what really stood out to me is your hands-on approach, kind of combining implementation science, health economics data to help healthcare organizations make really smart decisions about digital transformation. Thanks again to Professor Steven McPhail, Dr. Sundresan Naicker, and Associate Professor Amina Tariq for sharing all your insights with the Talking HealthTech team. I guess to learn more about AusHSI's work in digital health, we're going to leave all the important links in the show notes. But thanks for joining us on Talking HealthTech, and we'll catch you next time.
We hope you enjoyed this episode of Talking HealthTech. Make sure you like and subscribe and share this episode with someone who might find it valuable. For more information and resources about healthcare innovation, visit talkinghealthtech.com.